my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. You are just in time as we continue our conversation around World AIDS Day, and we are joined by infectious disease specialist and HIV clinician, Dr. Emile Reid, who is also now joined by one of Dr. Reid's professional patients, Cindy Pivacic. Now, earlier I got the date wrong, but Cindy was infected with HIV in the year 2004 and has since been working as an HIV activist. She is also joining us this morning to share a little bit more about her journey with HIV and AIDS. Now, Dr. Reid, I actually feel like today is a very important day to have these type of conversations where for someone that is HIV positive, how can they be encouraged to live a normal life?
That's a fantastic question. And I think the most important thing is to remember that one of the goals of antiretroviral treatment is to suppress the virus load completely. And I call it the speed of the virus. And that speed that you take in order to become sick, to get to the hospital, or that speed that you take to get to the graveyard when you die. So when you actually switch off the virus load and suppress it to zero, your speed is zero, which means you cannot move to the hospital, which means you cannot move to the graveyard, which also means that you cannot transmit the virus, meaning that if your virus load is suppressed and you continue to take your medication, means you can live a normal life. You can have babies in the normal way because you cannot transmit the virus.
So you can also be in a healthy sexual relationship with someone else?
Absolutely.
Okay.
Absolutely.
And what is it that people need to do as soon as they find out that they're infected with HIV?
Well, I think the most important thing is for people to go through the phases. Obviously, being shocked, being disappointed, being angry, you want to vent to somebody. And I think those are the normal processes that people get through. So towards the end of that venting period, I think one needs to find a good clinician to go to have an open and honest discussion about your condition, to get counseled regarding your disease and also the future, and to take it from there. Baseline bloods to be drawn, deciding on when is the correct time to initiate or commence antiviral treatment, and to build a special bond with your primary caregiver, because that relationship is not going to last for a year or two. It's a relationship that usually lasts forever, until either the doctor passes or the patient passes.
Sure, it's a commitment. Now, Cindy, did you go through those phases in the year 2004?
I most certainly did, yes. I also didn't disclose my status very early. I didn't go into medication early either, because those years, the information wasn't really there. And obviously now, at this point, I will advise people to really get themselves sorted well in advance of acquiring, because I was diagnosed with AIDS, in fact.
Sure.
Yeah.
Wow.
And when did you reach that point where you were comfortable to talk about it?
6 years. It took me 6 years to do so, especially in that era. It's people have grown now and they're much more open about their status, not as they should be, but they have developed over time, and that bit more comfortable disclosing their status now, going on medication earlier because of all the information that is out there. And that was part of the reason why I went public with my status, was because I realized there were people that didn't have anyone to speak to, and they would rather speak to somebody that is in the know and has been through it. And hence my disclosure. It took me a while. It was scary.
6 years. I mean, it's understandably so, because you've mentioned because of the lack of information that was out there, people weren't as open about having these kinds of conversations. I'm pretty sure that you've also gone through some discrimination in your life, and that's what we're trying to move away from.
Totally, but I think people have been too scared to say anything to me.
Would you kindly share, you know, some of the things that you have gone through after you have shared or disclosed your status?
Well, when I did go with my partner to hospital, when I took him prior to my being tested, there was definitely discrimination by the nursing staff,
Really?
the hospital staff. Sorry, Dr. Emile, but it's a true story.
It's true.
His status was disclosed in the hospital room, in a general ward. And that to me is a major discrimination against your personal life.
And your personal information.
Your personal information, absolutely.
Yeah. And I just want to add on, I'm so sorry,
Go for
Zoe,
it.
just try, in this notion of moving away from the stigma of HIV, you know, what is the HIV stigma, doctor?
Well, I think exactly what Cindy said. You know, people are being discriminated against purely based on their status. And hence the reason for people not to disclose. Hence the reason for people to actually keep it quiet. And I mean, having said earlier, you know, if you have a virus load that is suppressed or zero, why do you have to disclose? You know, because you are not putting anybody at any danger or in any danger. So why should you disclose? And the big thing is to remember is that HIV doesn't have a face. HIV doesn't have a trademark. People are not walking around with stamps on their forehead saying, I'm HIV positive. So divulging your status to those you are intimate with and those who are close to you is a moral and ethical thing. And patients should do it as soon as they feel comfortable to do it.
Absolutely.
Well, thank you so much for joining us this morning. This is the type of topic I feel like we need to unpack even more and more. I feel like there was something you wanted to say.
It's pretty much that people are in fear of, and I choose not to use the word stigma. I use the word discrimination, because they're discriminated against. That fear of being rejected is so huge still among certain cultures, especially, that you just need somebody out there that is HIV positive to be able to say, come speak to me.
And you're doing
does
just
help.
that.
Where can people speak to you, Cindy?
I'm easy to find. You just Google Cindy HIV, you'll find me.
Well, Cindy, thank you so much for joining us
pleasure.
this morning,
My
Dr.
pleasure.
Emile
Thank you
Reid.
for having
Thank
me.
you. And as we continue on the today World AIDS Day, let's continue to have these conversations and educate ourselves.